Welcome back. The New York Community Trust has been working with Urban Health Plan for over 20 years to create healthier communities in the Bronx. The most recent grant made in late 2023 will help provide coordinated comprehensive care for the elderly in the Bronx. Joining me now to discuss this relationship is the Deputy Vice President for Grants at the New York Community Trust, Irfan Hasan, and the President and CEO of Urban Health Plan, Paloma Izquierdo-Hernandez. Thank you both so much for joining me. Now, Irfan, can you tell me a little bit more about the New York Community Trust and, just the work that they've been doing over the past couple of years in, assisting New Yorkers?
Sure. Thank you, Gibby. The New York Community Trust is the community foundation for New York City, Westchester, and Long Island. And our goal at its core is to make New York better for all New Yorkers. So that includes everything from improving and addressing climate, to looking at healthcare, to looking at services for children, improving the systems that make New York a good place to live.
Now, this year, residents of New York City are empowered to vote on causes to receive $3 million in grants. What inspired this move towards participatory grant making?
Sure. So we are 100 years old this year, and that is, I think, something to celebrate. And as we start our second century, we wanted to hear from New Yorkers about the issues that are important to them. Via a code, New Yorkers can vote for issues that they think are critical, be it mental health, improving the nonprofit sector, strengthening democracy, addressing homelessness. These are all issues that our grants support, and we want to know what the priorities are for New Yorkers.
Now, how do you think it will impact the future of community-driven philanthropy?
Community-driven philanthropy is really about making sure that we address the needs of the community through the resources that we have, that we've received from generous New Yorkers who've cared about New York. So to me, it is just the best way to do things, is talk to the people who are going to be impacted and affected and benefiting, and hear from them where the needs are.
Thank you. Now, Paloma, can you tell our viewers a little bit more about the work Urban Health Plan does to help the community?
Sure. So, Urban Health Plan, and one, thank you for the opportunity to be here this morning, especially with such a good friend and a good partner. So, Urban Health Plan is a federally qualified community health center. We are celebrating our 50th anniversary right now, and we provide healthcare services, mostly primary care, because we really believe that primary care and prevention is critically important to improving the health of the communities that we serve. We also provide subspecialty care, oral health, dentistry, behavioral health, and then we provide a bunch of services that are related to health and that support the well-being of New Yorkers. So we have a workforce development center. We have created special clinics for special populations, such as the elderly. We have an adolescent health and wellness center. We also founded a charter school, because we really believe that in order to improve the health of our communities, there are other things than just health care that really affect them.
Now, my next question is for the both of you, and Irfan, we'll start with you. As mentioned, this is a 20-year partnership, kind of really making a difference in the Bronx. Can you explain what's the secret, or, what is that key to having such a successful partnership?
I think there are two things that go into any partnership, and this partnership is no different. It is trusting your partner and making sure that each partner brings the best of their game to the partnership. What we bring is a passion for making New York better, and we bring some resources in the form of grants. I can let Paloma speak to what Urban Health Plan brings, but what I think they bring is a strong commitment to improving health in the Bronx and beyond, and not just a commitment, but the knowledge and capacity, and again, the trust in the community. And that has helped us do some good things together.
Amazing. And then for you?
So I agree with everything that he said, and I think that it really does evolve around trust and trusting each other and believing in this in similar values, so that we're both committed to the same things. And I do think that understanding that philanthropy, especially foundations, should be seen as investors in programs and in initiatives that could really be sustained over the long haul and just not be supported by them, right? So the investments that the trust has made at Urban are long-standing ones and ones that have continued to survive and thrive. And I think that that's part of what makes the partnership so great, that they also view us as a good source of investment, that they know that we're going to continue to use that investment in ways that replicates and duplicates the services that we provide.
Now, I also want to mention that it's been such a long time. So as time goes on, people, they evolve and their needs change. In what ways have you realized that the needs for the community that you're serving has evolved and changed over time?
For me, as a health provider, I think the biggest aha moment I had was that our quality of care is really good. We have really good outcomes for our patients. And one day I realized that people's lives were not all that different, even though their health outcomes were different. And it just dawned on me that beyond just providing health care, it was time to look at what were some of the other drivers that existed in people's lives that contributed to their health. And so thus our expansion to workforce, to education, to financial, economic power, and those kind of things.
Now, I understand the PACE program was a critical part of, the work that you were doing to assist elderly New Yorkers. Can you tell me a little bit more about that program?
Sure. So we actually started serving pediatric population, the adult population. And then we started seeing that within the adult population, there's an older population. And we started providing, with some help from another partner, some case management services. And then we realized that maybe the elderly population would be better served by a clinic all on its own. And so we developed what is called the Center for Healthy Aging. And it is a clinic that focuses on individuals over 80, not 65, because 65-year-old is not old anymore. So over 80, people who are neurologically or cognitively impaired. And we now serve well over 1,500 patients in that particular clinic. And then we recognized that there was a need for medical home visiting, so that there were some homebound patients that couldn't come to the clinic because of their age, the frailty of their conditions. And so we started doing some medical home visits at home. And then we looked and said, well, what's left for this community, this population that we've served for 50 years, right? There's some patients who have been with us all this time. And there's a program called PACE, which is a program for the all-inclusive care of the elderly. And we thought, why not do that? And so we reached out to the trust to see how they could help in the planning and the development of that program.
And that's amazing. And I want to take a moment to kind of highlight the trust. Urban Health Plan is just one of many organizations that you work with. Can you just tell us, what the experience has been like, knowing that you can help so many different organizations and reach so many different people through these organizations in NYC?
So I think it is difficult because New York has close to 25,000 nonprofits, all of whom doing amazing work. I think we try to find partners and support projects that are looking to improve the systems. And as Paloma described with the services for older adults, that's a game-changing way of caring for our elders. So those are the sorts of thinking that go into as we think about what organizations the Trust can support to make New York better.
Now, when you look back on the Trust's history, what do you hope to see in terms of its long-term impact on the communities that it serves, especially in areas like health, affordable housing, and workforce development?
Well, I think these are all issues that have had a long-standing tail and will probably need to be addressed in different ways as we go forward. Part of our vision, our vision work that we're asking New Yorkers to contribute to respond to and tell us where we should go with our work is to help us kind of focus on where do we think are the biggest needs in the next few years, and how do we look to resource that and make and address those needs in a meaningful way.
Now, I kind of want to talk about as we're kind of approaching, the new year, start thinking a little bit early, but, what are some goals for the upcoming year that the Trust may have?
Well, we would like to start off 101 with a strong commitment to New York. We believe that our areas of work, be it in early childhood to older adults to housing to health, are all things that make New York better. So I would say it is recommitting to making sure that New York is a place that everybody can thrive in and everybody can enjoy life in.
And Paloma, we have about a minute left, but if you could just tell us, maybe what are some goals that your organization has for the upcoming year?
I think we have lots of goals as we enter our 51st year. One is to make sure that patients have timely access to care. I think that that's vitally important. When you talk about access to health care, you could talk about health insurance, which I think has become more available since the Affordable Care Act. However, now with Medicaid recertifications, there are a lot of people dropping off the rolls. So there should be really an effort in making sure that people who didn't certify get certified. I believe there's something like 500,000 people who could still lose their Medicaid coverage. So that's important, because if you don't have insurance coverage, that's vitally important. But then when you have the insurance, how accessible are services?
Right.
And that's really where timeliness comes in, because you could have access, but when? And so really focusing on those kind of things that really make a difference in people's lives, I think is really important. And really focusing on primary care and prevention, because I think not only will you get good quality outcomes, but you'll get lower costs in the healthcare system. And I think everyone will be healthier in the long run.
Well, with that, I want to thank you both so much for joining us. It was so nice to have you back and to learn about, your partnerships that you're doing to help make, New York a better place. So thank you both so much.
Thank you.
Thank you.
To learn more about the New York Community Trust efforts to empower New Yorkers to help shape their future grant making in 2025, please visit the website on the screen below. Stay tuned. We have more for you right after this.